By now, most of us have heard the term Metaverse. Companies around the globe have been busy creating this immersive reality. But what is the Metaverse? Simply put, it's a 3D version of the internet that people can access through virtual reality headsets. But how will healthcare fit into this new iteration of the internet? Dr. Brennan Spiegel is the Director of Health Services Research at Cedars-Sinai Medical Center. He wrote the book VRX, How Virtual Therapeutics Will Revolutionize Medicine, as a framework for how this next chapter may look.
The idea is that as we move into the inevitability of the metaverse, we need to think about how can we protect some corner of that metaverse, for good, not for some dystopian Ready Player One future, but for health and wellness, for healthcare.
Spiegel was first introduced to virtual reality almost a decade back. A small group of professors had already been studying the technology for decades, but a lack of public access to VR headsets kept their work in the dark. In 2014, when a Stanford professor approached Spiegel with the technology, he jumped at the opportunity.
And so the first thing he did is he had me jump off of a building in virtual reality. And I could barely do it because it had just hijacked my emotional systems in my brain. And I realized at that moment that VR is not like any other audiovisual medium ever created because it sort of overwhelms the brain. And, it could be used for gaming and entertainment, but could we also then use it to change human emotions and behaviors in a way that can support human health?
And now, 8 years later, Spiegel is using VR to successfully treat various medical conditions. He says the technology helps manage pain in a few key ways. The first is simply through distraction. Our brains can only keep track of a limited number of focuses at once. For example, when speaking with a friend, you're not counting how many times you blinked during the conversation or noticed the feeling of socks on your feet.
Virtual reality overwhelms the brain visually, and about 50% of the brain is dedicated to visual processing. So by overwhelming the spotlight of attention, we can swing that spotlight away from the physical sensations of pain. But we also know that it can help reduce the emotional experience of pain. So pain is not just a physical experience, but it's also a cognitive and emotional experience.
Thousands of years ago, Buddha called the physical and emotional experiences the two arrows of pain. The first sensation is a tangible feeling of agony when an arrow pierces your skin.
But the second is when you look at that arrow sticking out of your shoulder or whatever, and you think, oh my God, I'm going to die. Okay, that's the second arrow, the self-inflicted wound of living with pain. And virtual reality can help tamp down both the physical experience of pain through pure distraction and some other mechanisms, but also can help you with managing your thoughts about that pain, the metacognitive component.
Which is something traditional treatments like pain medication don't do. Though effective in treating pain, opioids aren't able to help patients develop skills to manage pain long term. The use of opioids can also lead to larger problems. The American Medical Association estimates that up to 19% of people taking prescription pain pills develop an addiction. In fact, 2 out of 3 drug overdose deaths in 2018 involved an opioid, according to the U.S. Department of Health and Human Services. However, Spiegel recognizes that even with new treatments making their way into the market, pain medication is still an effective solution for some.
I'm not saying that opioids have no role, because they do, but unto themselves, they're not going to provide a holistic approach to managing pain that might be supplemented with behavioral interventions like meditation, even hypnotherapy, or in this case, virtual reality.
But no single treatment plan will work for every patient. Spiegel says certain people are more responsive to VR therapy than others, so he's always working to find the right program for each person. But exactly how does this new type of therapy work? Doctors like Spiegel are constantly developing new VR applications for various conditions, such as phobias. Patients in traditional therapy are told to imagine being in a stressful situation, like a public speaking event, and that might create some stress.
But in virtual reality, you can literally put them in that moment. Literally, the brain feels like it is now in a room giving a lecture to a group of people, and you can practice over and over. That would be using it for like a phobia. But you also could, in that moment, give people things to think about and measure even their heart rate and their heart rate variability and their pupil diameter, and use biofeedback to demonstrate how their physiology and their nervous system is responding to those moments, and then practice over and over again in virtual reality.
But when treating chronic pain, Spiegel has his patients use VR for 56 days in a row. He says this helps them slowly develop cognitive behavioral therapy skills.
We start by introducing them to the idea of the brain and the body being connected. And then we slowly start to build up specific skills that become more and more complex and sophisticated over the course of those 8 weeks.
Spiegel's patient, Tom Norris, completed an early iteration of this treatment nearly 6 years ago. Norris has battled chronic pain for more than 30 years after radiation treatment for his testicular cancer left the base of his spine in shambles. Willing to try anything, Norris agreed to test out VR therapy. But what exactly does Norris see when he's in the program?
When you put on the headset, you learn about pain, you learn about breathing, and then they take you through some applications where you sit and you can practice your breathing. And one of the programs is you can cause flowers or tree to blossom or to glow or change colors based on your breathing pattern. And all that is picked up in a little sensor in the headset itself. It added to my ability to distract. It added to my awareness of breathing. It added to my ability to relax. And that was almost immediate.
While patients like Norris can't take the VR headset home with them, they can use an app on their phone that helps solidify what they've learned in the lab. Spiegel says these skills can be difficult to learn and even harder to maintain.
Cognitive behavioral therapy is really thinking about thinking. And that's not easy for everyone, which is why virtual reality can be very powerful as a way to accelerate metacognitions, which is the fancy word for thinking about your thinking. And the idea of this version of VR is not for people to live in VR forever. We want people to get out of VR, to be able to live in real reality in a richer and more powerful way with the help of learning in virtual reality.
So as patients reach the last weeks of their treatment, Spiegel begins graduating them back into the real world, step by step.
The goal is all of these lessons and experiences and skills that they've been practicing day in and day out in virtual reality can now be translated into their real lives. And they go back to not being in virtual reality, except when needed, to help support them through difficult times or to reinforce skills that maybe they need to practice again. So that's really the idea, is not to use VR forever, but to use it for a particular period of time where we carefully cultivate and develop new skills that can then be brought back into the real world.
Some critics of this treatment may worry that it can lead to an addiction to electronics. However, Spiegel says there are a few key reasons that make this unlikely.
People don't actually love to be in VR for very long. After 20 to 30 minutes of VR, some people tend to get a little bit, let's call it, dizzy, maybe even nauseous, have a little bit of vertigo. We call that cyber sickness or simulator sickness. But the other thing is we're not really using this for gaming or for entertainment. The programs we develop are meant to be used for 10 to 20 minutes at a time. They are not meant to be sticky. We don't specifically engineer them to cause people to want to stay in them or come back or getting, let's say, rewards that build or points or incentives. And we do monitor our patients, and we have not seen people becoming, let's say, addicted. Although on very rare occasions, I have seen people that really continue to use it. And these are people who in some cases had been on opioids. And if I had to choose as a clinician, I'd rather see a patient stuck on a VR headset than on opioids if I had to choose.
But thankfully, he says it hasn't reached that level, though some people continue occasional use after finishing their treatment. Since his initial sessions, Norris uses virtual reality about once a month to help refresh his pain management skills. However, he's found that the program can also help treat his other medical issues.
I have bladder cancer. And one of the things in bladder cancer, my particular strain of it, is every 3 months, they have to do a cystoscope exam, which is basically they go in through the penis and look for the tumors. Well, that's not fun, so to speak. So what the doctor here has gotten used to, when he walks in the room, I'm splayed out on the bed or the examining table with my VR headset on. and I am watching something in trip or standing on a beach or listening to the birds or watching the cat. I mean, I use this stuff to be able to stand, be able to divert my attention enough so I don't feel the awkwardness or the pain.
Even when doctors removed 3 tumors, Norris says VR kept him distracted during the surgery.
I didn't jump. I didn't feel the pain. I was someplace else.
The FDA has recognized these developments as part of a medical extended reality program. Spiegel believes clinicians shouldn't shy away from these technological advancements, but instead embrace them. You can find out more information on Dr. Brennan Spiegel and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Venom has been around longer than humans. Before there were neuroscientists, there were scorpions.
How scientists are using evolution's best weapon to cure medical conditions.
Then, how are mental wellness apps actually affecting your health?
It's a little bit tricky as a consumer to go through apps to figure out which ones could potentially be helpful and which ones are not going to harm you.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
It's not about just getting good reviews, and you can't rest on your laurels in that kind of way. Like, oh, we got a great review by the Chicago Tribune, we're good now. Like, no, we have to keep doing different things with our guests.
The many challenges of surviving the fine dining industry. Then,
most of us revert to some sort of what we call an adapter. It's a little nervous gesture.
What's your telltale sign when you're feeling tense or telling a lie? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.